To diagnose mental health disorders, psychiatrists use a manual called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM for short. The American Psychiatric Association just released its 5th edition of that manual, and according to local psychiatrists, it's causing a bit of controversy. Newswatch 12's Christy Lewis joins us now with what local doctors are concerned about with the changes.
A group of about 1,600 psychiatrists and psychologists all across the nation get together to create this manual. And after field trials, 15 new disorders are now in that 5th edition of the DSM. Illnesses like hoarding disorder, caffeine withdrawal, skin picking disorder are now in the latest version of the manual. Also, what you might have previously called a temper tantrum now has a name in the DSM, disruptive mood dysregulation order. But these new items on the DSM were not tested like other medical conditions for validity. Local doctors say they can't do a simple blood test or a chest x-ray to make a diagnosis. A lot of what they go by is patients' self-report. And this idea leads some doctors to fear that there will be more malingering among patients with minor mental issues. Another fear is whether or not the creation of these categories will drain funding for more severe conditions.
The funding available for mental health has rapidly dwindled. The prospect of having a whole bunch of new psychiatric conditions, many of which are relatively minor, that is concerning.
Psychiatrists are also concerned that the controversy among doctors about diagnostic categories could lower their credibility. They're concerned that the public could see their disagreements and doubt their ability to care for them properly. Dr. Hamill in Medford says at the end of the day, it's not necessarily about an official diagnosis, but just taking care of the patient, keeping them safe and on the track to recovery.